Today's Tit Talk, I'm going to talk about my preemies, my preemie tit talkers. And those are my little patients. And I'm going to talk about a really good quality improvement study done in Loma Linda, California, in their neonatology division that looked at breastfeeding rates in premature infants, both in the NICU and then at discharge. And what they found was, granted, this was a very small population sample size, but what they found was those infants who were nuzzling at the breast, meaning as soon as they were able, they were suckling, sniffing, licking at the breast, they had significantly higher exclusively breastfeeding rates after discharge. The other thing that they found was that it allowed moms to know how to actually hold a baby to breastfeed them. And they started this as soon as the baby was respiratory stable, so meaning extubated, but even on bubble CPAP, you can get these babies to the breast. And just a mom learning how to hold her baby at the breast before that baby is ready is a great skill. And also, if you are a NICU mom, oral cares, skin to skin, that nuzzling, that is all breastfeeding, okay? That is, even though they are not directly suckling at the breast or getting all their nutrition at the breast, that is still breastfeeding, okay? And there is not an age that you have to wait or a specific weight you have to hit to get that baby to do non-nutritive suckling or that nuzzling at an empty or partially empty breast. What they found was that if you get a child before they're ready for their oral feeds, they're either NG or OG, and you get that baby at the breast for that nuzzling, they do better breastfeeding whenever they're ready for oral feeds. So you do breastfeeding first, nuzzling, whatever that is going to look like, and then you finish the feed with gavage as opposed to doing a bottle. Babies are not more physiologically unstable with a breast or a bottle, because if a baby stops sucking, the flow from the breast stops. But if a baby stops sucking on a bottle, the flow doesn't stop. The flow continues because you have an open hole versus a hole that you have to extract milk out of. Unless, of course, there's a really active letdown, but that is so obvious that most parents instinctually know to whoa, this is spraying, say it, don't spray it kind of a deal, boob. Think of it like teaching a child to ride a bike. Just because your kid falls off or doesn't get it the first time doesn't mean you stop teaching them to ride a bike. You just have to keep practicing. So even if you're only doing 1 to 2 attempts at the breast a day, you keep doing it as long as you want to, okay? Because that is going to be the practice they need. Now, if you don't want to do that, that is entirely up to you. I don't care. It's not my baby. It's not my body. It's not my choice. But my last tip, my last reminder, and this is for everybody, not just preemies, is never quit on a bad day, only quit on a good day. So you are clear-headed and you are consciously making that decision.